Let us see how our public health services are provided in India at a different level. In the last class, we have seen a case study with Sarita and Kiran, who were suffering with the illness and got treatment from two different health services called public health services and private health services. These are the two categories we find in health services. So let us find out the differences between public health services and private health services. First, we will look and study how public health services are provided in India. Public health services is a system of providing health services under the control of government. Hospitals, healthcare centers which run by the control and authority of the government are called public health services. In our Karimnagar district, we find one civil hospital, that is public health services, which runs by the government. So public health services run by the government, and here all kinds of problems are treated, from one common illness to special services, that is a simple fever to very what you call deadly dangerous diseases like chikungunya, what you call this, AIDS. There is no treatment, there is no medicine. Recently we see that corona, right? And heart patients, sugar patients, right? These are all provided, from small to big, and chronic diseases are given for those what you call diseases. There is a treatment for all the people, understand. Public health services we find at rural area and urban area, treating all kinds of problem. Okay, so what is a public health services? It is a system of health centers and hospitals run by the government, understand what it is? It's a system of health centers, hospitals run by government, where treatment is provided to all kinds of problems which are provided at rural area and urban area, understand. So let's find out how these are working. Okay, in every village, have you identified asha workers? In every village we find a volunteer called as asha workers. What do you call? Asha workers. Asha workers are allotted at a village level, and they provide health services. What is mean by asha? Aggregated social health activist, ఓ కార్యకర్త అంటాం తెలుగులో. ఓకే, అగ్రిగేటెడ్ social health activist, in short called asha. So we find asha workers at every village in giving health services, and we also find Anganwadis in the villages, right? Have you seen the Anganwadis in every village? Their Anganwadi center workers provide nutritious food to the small children and what to call immunization services are given to the children. Small children weights are monitored and they are given nutrition immunization at a time to time by Anganwadi centers, right? By Anganwadi centers, nutritious food than eggs are supplied. So these Anganwadis provide nutrition, immunization to the young children at village level, right? See, in rural area, we find a sub-center. What is that? A sub-center, understand? Which covers 5,000 people. Okay, in every village we find an ASHA worker, and for 5,000 people in rural area we find one sub-center. Which one? Sub-center. It means under a sub-center we find 5,000 people. That means 5,000 people of different villages in rural area are given health services with sub-center. And this sub-center is what to call at a rural area consisting of a what to call a multi-purpose health assistants. What do you call? Multi-purpose health assistants. Okay, it is that they are under sub-center. They are trained one health workers called multi-purpose health assistants. What we call multi-purpose health assistants. They may be either female or male assistants at a sub-center. At a rural area, we find a sub-center covering what you call sub-center. Let me write here. A sub-center where we see that 5,000 people are treated. 5,000 people are given health services with the help of a MPHAS, that is multi-purpose health assistants. Understand? These multi-purpose health assistants are trained in dealing some common illnesses. They provide what you call immunization to the children and also take care of the pregnant women. They take the steps to control diarrhea and malaria. Understand? Diarrhea, malaria, these are controlled by the sub-center. Understand? Where we find multi-purpose health assistants who are trained. Understand? And these multi-purpose health assistants who are with one sub-center will look after 5,000 people. It may be of one village or maybe of 2-3 villages. Okay, for every 5,000 people we find one sub-center at a rural area, right? And here we find multi-purpose health assistants, and above this we find another one, that is a primary health center, which is at mandal level. Understand? That means sub-center which covers 5,000 people works under primary health center. primary health center is located at mandal level. Each primary health center covers 30,000 people. 30,000 people. Then one sub-center covers 5,000 people. So how many sub-centers we find under one primary health center? Huh? That means 6. 5 to 6 sub-centers are under one primary health center which is at a mandal level covering 30,000 people, right? And these 30,000 people who are covered with one primary health care center, okay, are under a community health center. Okay, we find one community health center for 5 to 4 primary health centers. It means sub centers. What I am saying, sub centers cover 5,000 people, and these sub centers are under a primary health centers which is at mandal level, right? And this covers 30,000 people. How many? 30,000 people. And 4 to 5 primary health centers are under one community health center. Understand? This is a community health center. And at divisional level, we find area hospital. Area hospital. And at district level, we find district hospital. What is that? District hospital. Okay. So many government hospitals we find in this way. Okay. That is what you call in a rural area. Understand? It means that at a district level we find one hospital, and below this district hospital we find area hospital which covers 100 beds. How many? 100 beds. Under area hospital we find one community health center. Which one? Community health center. This is covered 30 beds, and every community health center consists of near to 4 or 5 primary health centers. Understand? In every primary health center we find 30,000 people are treated. So in community health center it is 30 into 5. That means 1,50,000. 1,50,000 people are treated at a community health center. Understand? And this community health center works under at a divisional level where we find some 100 beds. Understand? And here some special kind of surgeries also what to call treated at a area level and at a district level. And large cities, in large cities we find many government hospitals. In the case study we have seen where what to call Kiran was taken in the example. In our district we have a large government hospital we call civil hospital, right? So there the treatment is given, and these are all under a government. Government runs these all the hospitals with the financial resources what we pay in the form of taxes. We are the people paying taxes to the government, and our taxes, what we pay the taxes to the government, becomes income to the government, and with that income government provides hospital hospitals and healthcare services to the people, right? It is a duty of the government, understand, to provide healthcare services to all, understand. So that we call it a public. As it is used by many people, we call it a public, which are run by the government to provide healthcare services to all. Lakhs of people are not able to get health services under private because medical expenses are high. We know that. See, in the recent time, as the COVID is going on, I have come with one experience and I listened to one patient who had paid near about 80 crores, sorry, 80 lakhs. 80 lakhs he expensed in the hospital. At last, he died. He was a rich person, so that he went to private hospital suffering with the COVID. There he took treatment, what to call, on ventilation. Then also he did not recover, and he died after paying 80 lakhs. Think of the common people. How do they afford this kind of health services? So it is very essential to provide health services to all the people, and it's a duty of the government. The constitution guaranteed that health services to be provided to all, right? So the government is running public health services, what to call, at village level, at mandal level, and at divisional level, than at a district level. This is the system and structure of providing health services to all the citizens, right? Everyone can use these services at low cost or free, understand. As these are meant for all of us, we call them public health services, understand. And here we see that it is a commitment of the government to provide health care to all the citizens, understand. And these resources to be given to all. That means the resources needed to run these public health services are obtained. That means money what we collect, what we pay to the government, through which the government runs these services. Understand? Look at the figure given here. One primary health center at mandal level. Okay. So in this way, health services are provided with a, what to call, government. Understand? It is what to call, we find many of the health related problems are treated at district level. At village level, we find ASHA workers, they give a little treatment for small health related problems, right? So one of the most important aspect of the public health system is to provide quality health care services. Why do we have public health care services? We have public health care services to provide quality health care services for free or at a low cost. Understand? Poor people cannot afford these services uh, by private health services. Understand? So the main aspect of the public health system is to provide quality. Which one? That is quality health care services. What is that? Quality health care services to be provided to the people. That is the one important aspect of the public health care system. And second is that to control or to prevent the diseases like TB, malaria, jaundice, cholera, diarrhea, chikungunya, etc. These all are the diseases to be controlled. This is a second important aspect of public health care system. Understand, right? And for these purpose, for for providing better and quality health services, government should move with the participation of the people. When people participate and support and help the government in giving quality health services, then there will be effective health services. If people do not cooperate, the health services may not get a success. For example, in village area, we see that there the government primary health centers workers will go on, the municipality workers go on spraying the water liquid in open showerages so that the mosquitoes could not spread, right? In our home we find that many of the what to call coolers, right, and rooftops where the water is stagnant. So where water is stagnant, there mosquito will spread, right? If we do not keep our surroundings clean, it leads to spreading the mosquito, right? Mosquito will harm us in many ways, right? First we need to keep environment neat, right? So that means we have to see our surroundings without a stagnation of water. This is the work of the people. Every citizen, every individual has to work for this. In every home, nearby every home surroundings, everyone has to take care of their surroundings to stop and prevent the spreading of the mosquitoes so that they could not breed in water, coolers, and rooftops, right? This is to be done, okay, by all the residents of an area. It may be a village, it may be a mandal, or it may be district, or it may be the what to call our area. Understand, in village everyone must be involved, right? See, if a nearby water tap, in village we see that a public tap will be there, right there. If water is stagnant, then the person who is looking to that one immediately should be informed, or voluntarily has to go for water removing that stagnant water, understand, which stops the water mosquitoes breeding, okay, when water is removed. Understand, this is the what to call primary health care centers running with the what to call government. So in this way the government is providing health services to the people, okay, at a different levels. Understand, this is the word in the figure 9.2. See that in a hospital their number of beds are provided. So here it is health services given by the government, free of cost or minimum cost is minimum fee will be there. Understand, and coming to the what to call private health services, we in towns, in cities we find a wide range of private health services. What is meant by private health services? These are not provided by the government. These are provided by individual people or some companies to earn the profit. Understand? So in the cities and in the towns, we find a large number of private health facilities existed in our country. In rural area also we find private health services in the form of RMPs, right? What is meant by RMP? Registered medical practitioner, right? Have you listened this word RMP? Who goes to door by door, home by home in treating the what patients, right? he is called RMP. Okay, this is the what private health services. He charges for everything, right? And another kind of private health services in rural area is untrained medical persons. Untrained medical persons means those are not a trained one. By the experience, they go on treating the patients. In Telugu, we call not to వైద్యులు అంటాం. Okay, they are not aware of everything. Whatever the experience, little experience they have, with that only they treat. So those are called untrained medical persons. Okay, these are the what to call private health services we find in a rural area. In urban areas too, we find what you call these private health services. Instead, in urban area, we find large number of doctors providing specialized services in their private hospitals and nursing homes, right? We have seen that what you call a cardiology center, right? An orthopedic center, then what you call gynecologist hospitals are we have. Some are specialized for eye, some are specialized for treating the patients suffering with a kidneys problem, some are specialized in what you call delivering the what pregnant one, right? So different kinds of special services are provided by the private hospitals with large number of doctors instead. And they have we find many of the private laboratories also, which you go for what testing the blood, urine, and other things, x-rays, ultrasound system, MRI scan, like these are provided. For everything they charge, understand. And many of the private hospitals are run by large companies. Okay, and some of the companies are selling the what medical what you call tools, that what you call x-ray taking a machine, right? MRI scan machine. These are manufactured by the big and large companies. Medical shops, we find every corner of the country. In every street we find a medical shop, right? Medical shop is private one, understand. For there we have to pay money, understand. Then as a name it says private health facilities, they are not owned by the government. These are not run under the control of government, they are free from the government control, understand. So where the public health services, where the patients have not paid anything. In private health services, people have to pay a lot of money for every services what they get, understand. And here government provides public health services by the taxes collected from us, understand. Whereas the private health care services are operated for profit, understand. They look at the cost what they invested, and on that investment they want to earn the profit. So they will calculate what is the cost and the profit they are going to earn on the hospital, right? So therefore they charge everything, understand. So the fee collected by private hospitals are high, understand. We cannot afford it, understand. That is what you call, some people will go on finding very difficult and get fear to get treatment in private hospitals. Do you know this? Because there will be lakhs of expenditure in what you call private hospitals instead. So people will fear to go to the what private hospitals instead. So this, in this way private hospitals are running for earning the what money instead. So here it is clear that many of the people are not able to get private health services due to the lack of money, understand. And medicine also very expensive in private hospital, right? Ordinary people cannot get it, understand. So if health insurance is provided to the public, then they may get it under health insurance, understand. So today we see that many companies are providing insurances, health insurances to people. Star Health Insurance, uh, then LIC, then New York Life Insurance, uh, then like these several companies, GIC, like these what to call private companies are providing health insurance. What will come with health insurance? Once they get health insurance, whatever the medical expenses they have to bear, that will be paid by insurance company. Understand? So today we find many of the insurance companies in the market which are run for public and private sector. Private sector also running the what health insurance companies, and public sector also running the what health insurance companies. Here